Thank you very much for the kind introduction. Yeah, my name is Beate Conrady, and I have the pleasure of delivering the final talk on this day under the topic Enhancing Epidemic Intelligence in Europe through Advanced Computational Models for Sustainable One Health Actions. In this presentation, I would like to summarize the challenges and opportunities already mentioned in previous talks and substantiate them with examples from Denmark. Further, I will delve into perspectives to enhance epidemic intelligence through computational models for sustainable One Health actions. As we already heard by Fanny, there are several challenges in data sharing and modeling to improve epidemic intelligence in Europe. I have summarized these challenges from the previous talks as follows. Data sources we use are often extremely heterogeneous and difficult to combine for our research purpose. The talk by Francesca also highlighted that certain types of data are not recorded, are not available or not public domain. Sometimes we work with not updated data, and there are issues with the availability of real-time data. We have legal issues, and these legal issues complicate the smooth flow of data and also cause issues in implementation of interfaces between users, platforms, and institutions. We have compatibility challenges, such as resolution of difference in the data. We have different file formats, data formats, and we have different encoding standards. We have sometimes issue to understand the data. So how the data was collected. Are there any bias in the data that influence my research conclusions? And we have also issues to ensure a high data security. And now I would like to illustrate how I arrived in a not 100% correct research conclusion because I was not aware that my data were biased. And I would like to demonstrate this using Salmonella Dublin as an example. So Salmonella Dublin is endemic in the Danish cattle population and it's zoonosis. The infection is mainly contracted through direct contacts with cattle, exposure to the fecal matters, or by consuming contaminated food. It's important to note that many Salmonella Dublin infected cattle do not show any clinical symptoms, which make it even more challenging to control the disease. Consequently, the government implemented a control and eradication program since 2010 for both dairy and non-dairy herds. And the program includes movement restrictions between Salmonella Dublin test positive farms, referred to as Salmonella Dublin affected, and Salmonella Dublin test negative farms, referred to non-infected farms. On top to the movement restrictions, a regionalization was implemented, and the latest phase of the regionalization you can see in this map in the period 2013 to 2017. The regionalization includes movement restrictions between the red areas, geographical areas with a high Salmonella Dublin prevalence, and the green areas, areas with a low Salmonella Dublin prevalence. This means that cattle cannot be moved between these both areas. Even the farms located in the red areas were Salmonella Dublin free. Despite all efforts made to control and eradicate Salmonella Dublin, the herd prevalence is still on rise in Denmark. And the veterinary authorities asked me why. Why is the apparent herd prevalence increasing despite movement restrictions between infected and non-infected cattle farms? And I should gain new knowledge regarding the transmission pathways and quantify the associated impact of the pathways for the spread of Salmonella Dublin. To answer these questions, I have merged the cattle movement database with the Salmonella Dublin surveillance database, shown here in this map for 1 month over an 11-year study period. So the red lines highlighted the movement activities of infected farms, and the green lines highlight movement activities of non-infected farms. And the thickness of the lines represents the number of moved cattle. In addition to whether movements could be a transmission pathway, we were also interested if local transmission could be another transmission pathway. So for the local transmission, we searched for infected farms in a 5-kilometer radius and analyzed if new infection occurred in the next 1, 2, 3, 4 months based on recorded data. And the strongest predicted variable to become Salmonella Dublin infected over a 6-month prediction time window was through movement activities between cattle farms with twice the odds ratio compared to the local transmission. Our model was adjusted to farm size, trade months, and production categories and total neighborhood in order to include also all demographical changes in the livestock sector. As we have identified that movements play an important role in the transmission of Salmonella Dublin, more so than the local transmission, we decided to conduct a more comprehensive study and focusing more on the cattle movements, using network analysis as a tool, stratifying the movements in infected and non-infected pathways. And the network results indicated that the trading patterns of infected farms were not affected by the movement restrictions such as the regularization shown here with the pink lines. So the network properties were quite similar over the period, also in the period where we include the movement restriction via the regularization. And our conclusion was that the implemented movement restrictions have had no market impact on the trade patterns, as rare long animal movements. On average, a cattle was moved 70 kilometers, favor the resilience against spreading of Salmonella Dublin to other regions, probably causing a higher Salmonella Dublin prevalence in already high prevalence geographical regions in Denmark. Our simulation model, which is a compartment model, also indicated an endemic situation in Denmark for the next 5 years. Consequently, the government decided to update the legislation and shifting from eradication to control this year. And another recommendation was get in touch with the farmer and understand why they didn't follow the Danish legislation, why they moved infected cattle. And I was interested in understanding it myself. So after some discussions with the farmers, I discovered that the farmers have the possibility to establish multi-site businesses. So several farms, like 200 farms, can be part of it. They are far away, 200 kilometers. And farms which are part of these multi-site businesses, when one farm becomes infected with Salmonella Dublin, all other farms become automatically also infected with Salmonella Dublin, even if there was no transmission of Salmonella Dublin via movements, without testing, causing a higher rate of false positive test results in the official surveillance program. And I used the data from the official surveillance program for my analysis. This means that some cases I assigned of infection via movements, which were assignments of infection through the multi-site business approach. And we can observe an increased number of multi-site businesses in Denmark, and the main driver is our economy. The Danish tax system favors the increasing number of multi-site businesses. Another pathway is our energy sector. So we have increased number of biogas facilities in Denmark and transporters collecting the manure from the farmers, bringing it to the increased number of biogas facilities, spreading also the Salmonella Dublin bacteria. With this example, I wanted to show you that it's important to include also surrounding systems in your research. So look on the left and right side when you conducted your research, instead just to focus on your piece of research in order to discover maybe bias in your data. Show the willingness to understand other system components. And this brings me already to the perspective number 1. It would be nice to combine different data sets or to have access to different data sets and create a dynamic SQL One Health data sets. I have currently access to many different data sets, to antimicrobial vaccines, how many they are used, to aquatic and terrestrial livestock, so the farm register, so I know the composition, the breed and age of the animals per farm. But I have also access, for example, to the ES Green tool. This is a new established tool that measures the emissions in the livestock production, because we will get a new taxation system in Denmark in 2030. And I have access to all these data. And one example that at the EU level that show us that it's possible to create a common solution also regarding modeling frameworks is the new established Center of Excellence for Disease Modeling, the EUFMDIS Modeling Center. Here you can see that 15 countries using one common modeling approach with the same assumptions, and they share the data with the predefined data formats. And they can simulate outbreaks, analyze different mitigation measures, analyze if they are effective or efficient, both at the national or at EU level. We can simulate the sharing of resources. So when we lack of human resources to cow our herds or to disinfect or to perform surveillance, what would happen if the neighbor gave us some human resources? How would this influence the epidemic size? And such models at the EU level were used in the past, for example, to analyze if potential adaptations of the war code chapter to reduce waiting periods in case of an FMD outbreak for protective vaccination are efficient or not. And when we use such common modeling frameworks, we will also discover that there are culture and social differences. So some countries said it's not necessary to analyze vaccination mitigation strategies against FMD, because we will never start to vaccinate against FMD. But we will also discover where the bottlenecks. So maybe we will discover that the epidemic size is much bigger because we are lacking of human capacities, or our diagnostic capacities are not sufficient, and so on. And yes, such successful projects are based not only on trust in sharing data, but also on a high level of data security. So my access to many different Danish databases is possible because we have established a secure data sharing approach using end-to-end encryption. And this ensures that data cannot be read without a decryption key, because anonymization alone is, I would say, insufficient. Very smart people can discover which farmer is behind Alice and Bob based on specific farm metadata. And end-to-end encryption guarantees that only authorized individuals with an appropriate key can access and read the data. If the governments or the private industry decide to revoke my access, remove my key, I would see this picture. This means unreadable data similar to what you would see if you tried to access my hard drive with your computer. So I think end-to-end encryption is one of the ways to keep data secure, because computers can be stolen or hacked. And I think with robust data security, with access to multiple data sets, we are able also to measure associations between different system components. Because we always try to improve our system, like, for example, use manure for our increasing energy demand. But make it more worse on another place, yeah? Contributing to spreading of Salmonella Dublin. And if we can measure these associations between different system components, we are able to discover One Health, really sustainable One Health solution, and not be always in our loop to try and improve and make it worse on another place. And yeah, for instance, often it's the case that our economy drive us to grow, compels us to increase the herd size, resulting in more transmission pathways for diseases as more animals are present in the herd. Every year, 3 new agents jumps from animals to humans, causing a potential zoonotic or pandemic risk. To address this, we are investing in control programs, starting in the development of new vaccines, and antimicrobial use to improve animal health by causing antimicrobial resistance, causing a public risk, a lack of trust in animal production, consequently leading to economic instability, which used to be our driver of growth. And my team and I in Copenhagen, we are working on an R package that is designed to measure these associations and deconflate these associations. A simple example. So paratuberculosis, I tried to work with this very nice laser pointer. The paratuberculosis is often associated with lameness. Lameness is often associated with milk fever or with clinical mastitis. So diseases are interconnected. They are nested. What we are doing, we're publishing paper. The production losses of paratuberculosis was 20 million euro. Next year, we publish BVD costs us 10 million euro. And we neglect the fact that the diseases are interconnected. And if we neglect this, then we double count impacts. Yeah? We overestimate when we just focus on single diseases or single system components. And we're working on an R package that based on Bayesian theorem that designed the impact to one disease on another disease, depending of their association. This is the conditional Bayesian approach, and the R package tried to adjust it so that you not overestimate the impact and avoid the double counting of impacts. And the user can upload different kind of data sets. We did this for the global dairy cattle diseases, and you can see here different diseases. And in case you deconflate, then you have much lower production losses in US dollar compared where you just focus on one disease and ignore that, for example, clinical mastitis is associated with many other diseases. And yeah, the R package should be hopefully soon available that everyone can use it. And we wanted to extend it also not just to diseases, but also to other system components, like, for example, mitigation measures. But the most important message is to enhance epidemic intelligence in Europe, we have to work together, understand each other's systems, or at least showing the willingness. And we need people with the right leadership skills and collaborative mindsets in order to enhance epidemic intelligence in Europe. And that's it from my side, and thank you that you gave me the opportunity to talk in front of you. Thanks.